morning, everybody. Namaste. I heartily welcome one and all present here. A warm welcome to all our guests. We are honored to have Dr. Samsa Fiaz, the professor and HOD of PG Department of Shalakya Tantra, NIA Jaipur. Heartily welcome to you, ma'am. Thanking you for taking out time from your busy schedule and coming here to motivate us. I think your presence will make a lot of difference in young minds sitting in this hall. The ma'am is the author of the book Concept of Glaucoma in Ayurveda and Modern Science, comprehensive approach to nasha rogues and nasal diseases. Currently, ma'am is serving in advisory member for Purnanava, an international peer-reviewed journal of Ayurveda, NIA Jaipur, an eminent resource person for Ayusha Journal. And she is also serving as the chairperson of Interdepartmental Review Board and Testimonial Committee, NIA Jaipur. And ma'am is also appointed as the president of Association of Shalki Rajasthan branch. Welcome, ma'am.
With a lot of content regarding glaucoma, but definitely there may be some mixing, but I will take care that I will deliver only that content which has not reached to you till now. And I'm very happy to look at the strength of this hall, because it is lunch time and all of you are very hungry, so I won't take much time. But whatever I deliver, by the end of this session, you will know how to plan the treatment of glaucoma in Ayurveda aspect, and what you have to do when the patient approaches you, and what are the simple remedies which you can adopt in your OBD setup. Because I know most of you are not from the Shalakya specialty, but definitely you can do some justice to the patient. So this why we need to consider Ayurveda intervention an important aspect in glaucoma patients, because as madam also has highlighted, glaucoma is rapidly increasing, and we know that cataract is manageable and it is one of the most important cause for blindness. But at the same time, glaucoma, there is no treatment for it. It is an irreversible loss for the patient, and he is finally going into a blind world. So in order to prevent that, our intervention is equally important. So I will tell you in my lecture what we can do as an Ayurveda expert and how we can effectively manage this disease. Okay. And you know what the statistics of glaucoma is worldwide as well as in India. It is increasing rapidly. So we have to think over it. So you know, all of you have got the information that glaucoma can be correlated to Adhimant. Definitely, it is one of the nearest correlation, because here also the patient will be undergoing severe pain. That is Tivra Vedana, what is mentioned in our classics. So based on that, we can definitely correlate to this glaucoma. And at the same time, what the modern people say, the risk factor is increased IOP, which can easily be managed. But the most important aspect is the optic neuropathy, which is going to take place simultaneously, and for which there is no treatment in modern science. So we as Ayurveda experts have to tackle this condition, and we is getting some brains now. So this is what Ayurveda interprets as the fifth condition, which is the specificity in Samupalalata and Bhuvakti Pradesh. So this is the main characteristic feature. So any patient who comes to your OPD, you always you go who's complaining of severe headache or any pain in these related structures, always you go send for vision examination. I think that is available in each and every center, and also mandatory vision is closely. Because you will be able to save the vision of the patient if you diagnose properly. Okay? So as we all know that in glaucoma, also we have to meet as in Ayurveda also, four types of glaucoma, and in my further slides I will be integrating how we can correlate to the modern aspects of glaucoma.
course of time. And also if you think about how this technology can be integrated in dosha direction, because that is very, very important. Kapha, what is it is going to cause in life? It will give rise to this amagapati, and it will also give rise to, there will be activation of metabolic metabolites and at the same time it will give rise to occlusion of the visual. And at the same time pitta what role it is going to play in this condition. So this biochemical theory, it states that there will be increased IOP because of this. So either IOP will be affected in excess, or it will be, there will be some hindrance to its drainage, or there may be increased perfusion, and that will give rise to hypoxia, and definitely there will be damage to the OMP. And what is the role of pitta? That I mean vata. It is very, very important. Vata, again we have to think of the optic nerve here, which is very, very important for our vision. So this will give rise to this cell apoptosis, that is death, as well as there will be neurodegeneration, which can be prevented if we start early intervention. So this is the you can again analyze this samprapti in a more detailed sense. Here how at the meshwork, trabecular meshwork, there will be marga avarodha or sprota avarodh or sangha will take place. So because of this sangha, whenever it is accumulated, then there will be hyperperfusion, especially at the optic nerve head. Here this is what we have to concentrate as Ayurveda physicians. And also there will be at the same time a failure of immunity, autoimmunity. There will be failure of this autoimmunity and also apoptosis. So here what we have to start with some vyadi shamatvahara dravyas, immunomodulated drugs, chakshusha dravyas, which are equally important in order to combat this stage, because there are really many theories, but proven there it is none. So that is why we have to concentrate on each and every step. Then we have this dhatukshaya. So here we can take this optic nerve neuropathy in the form of dhatukshaya, which is continuously going on in a glaucoma patient, and in due course of time it will cause damage to his vision. And also there will be visual field defects. So that can also be studied under Pattalaga Timir. So what it is having, a field of vision also will be constituted, and central vision only will be remaining, and that also will be vanished in due course of time. So we can also analyze the Vishesh Samprapti in glaucoma. That is very, very important. So here we say Rasarakta. There will be impairment at the level of Rasarakta. So what impairment we have to think it over. So either there will be loss of spiritva, or the vessels, vascular structures, which have to be tight meshworks, that will be loose. So whenever there is a gap in between the vascular structure, what happens? There will be perfusion, leakages. So that leakage will give rise to accumulation, and this accumulation may not only take at the trabecular meshwork, but it will also taking place in the retina. So that also we should think. So and this sankocha, vispana of the scrotamsi, that is also affected. And then this vata prakopa, especially vyana vayu, that will give rise to disturbance in rasarakta vahana, means circulation. Circulation is also impaired. And circulation is impaired, what will happen? Apoptosis. Nutrition will not reach to the particular site, and death, cell death. And also pranavayu, it is also causes drishti upaghata or nasha. So this is also very, very important. Then we have to also think of this alochaka pitta. So this alochaka pitta is very, very important. So this pitta amsha is which is present in the eye. So this also is damaged. It will help in rupa grahana will be affected. And then we have this sarpaka kapha. So this aqueous can also be taken as a sarpaka kapha, which will go to nourish, and also it is giving rise to the structure of this thing also will be damaged, because kapha not only take care, all the structural deformity is damaged. Structure of the vessels, then the sclera, everything will be damaged, and that is how it will give rise to collapse of the channels and ONH. And this mamsa dhatu. So in what level mamsa dhatu is affected? Is the structural integrity of blood vessels, especially because of that there will be perfusion. So and then we have this rasarakta. So in rasarakta, if there is high pichila guna, that is quality of the blood, which has to nourish the ocular tissues, that will be decreased. So this is the all the this thing Vishesha Samrapti, but here what I would like to highlight is the Kriya Kala stages, because these are very important as per Shishruta, at what stage what we have to plan. So that is why there will be Sanchaya at the stage. Initially there will be Sanchaya, then Prakopa. Sanchaya will be in the ocular tissue, then Prakopa from that side, and then it is Prasara, Sthana Samshraya, and that Sthana Samshraya will be at the optic nerve head, and then finally Vyakta Avastha, and then Upadrava. So all these stages will be seen in glaucoma, and if at the same time we have to analyze at what stage the disease is, so that we can plan the treatment effectively. Because in Ayurveda, personalized treatment is highlighted for each and every patient, depending upon the prakriti, depending upon the stage, depending upon the dosha vishesha. So this is the classification what all our other speakers have also highlighted, how there will be congenital, developmental, primary, and this secondary glaucoma, and how we can understand this classification is very important. So in Vataja Adimanta, in Ayurveda we have Vata, Pitta, Kapha, Rakta, and the complication, that is the Upadruva. Rupa is the Hatadimanta, that I will explain you in next. So we have primary congenital glaucoma. So this is the Sahaja Rupa, which will Bija Rupa defect, that is at the level of the chromosomes. There may be any gene defect that can be included in this Sahaja Rupa. And what we can do at this stage is, whenever patient comes with the symptoms of this primary congenital glaucoma, we have to give Ayurveda intervention. At the same time, we have to not only concentrate on decreasing the IOP, but also we have to concentrate on the optic nerve damage. That can be, we can start at an early intervention of major this Chakshusha Dravyas, then immunomodulators from a very early stage, so that the disease at to some point it can be arrested, or we can prevent the further changes which are going to take place. So in this way, most of the treatment what is prescribed is surgical. We can plan the surgical treatment also, because that is also equally important. Goniotomy or trabeculectomy, or sometimes combined therapy is very important, and that also can be planned. And this IOP can be controlled with this ocular hypertensive drugs. Okay. So this primary open angle glaucoma, as most of our speakers have told, so this the angle will be open, so the patient will not be having any problem. So the pain may be very mild. So when the pain is very severe, definitely patient will come to us. But when there is no pain, he will not come. So many times what I do as a routine, after 40 years, we have to check the IOP, and surprisingly the IOP will be raised. The patient himself will not be knowing, and when we go for fundoscopy, then the disc ratio, cup disc ratio will be enhanced, and afterwards we will come to know he's having glaucoma. So this can be arrested. This is the silent key, especially more common in India, and which is stealing away our vision. So we have to, and especially in myopic patients and diabetic patients, we have this disease is more prone. So we have to give equal concentration in these patients, so that we can prevent the reverse pathogenesis. And so here you see Kapha-Jadimant, this primary open angle glaucoma can definitely be correlated to Kapha-Jadimant, and so for each Adimant the treatment is totally different. Even though there will be the medicines which we select will be different, even though the therapies will be same, but the medicines will be totally different. That you have to understand. It is not the same treatment in same glaucoma. So you should know at what medicine you have to select, because Kaphahara Dravyas are very, very important in this condition. So these are the symptoms. The patient will have swelling of Shukla Mandala, what you see, I have already highlighted. Along with that, see, excess of salivation, Kapha Praseka, or this Kaphaja symptoms, Agni Mandhya symptoms will also be included in this, and that's why the patient will also have blocked nostril. So whenever a patient he comes to your OPD, you have to also think that his problem may be even in the eyes. So you should also, when there is no problem in the nose, or if there is this continuously, if the patient is having this, then you have to go for an ophthalmic examination. And you have to also examine the Shukla Mandala, Krishna Mandala, and also you have to examine the this angle. So angle will be wide angle in this. So these are the other symptoms: kandu, heaviness. It is common
common in all Kafaja conditions. So this will also be manifested here. And this headache will be very mild. So you cannot take it as a factor. But in case of primary angle closure glaucoma, the picture is totally different. The patient will present with severe pain because whenever this angle is closed, there will be severe pain, especially when in the night time when the pupil is dilated, the patient will suddenly will get severe pain in the eye. So that is also a very important point, and usually increases after the age of 60. So that is why routinely we have to check the angle, and also we have to measure his IOP. So in this way, there will be rapid progression or impairment in the vision if you check this patient. Signs and symptoms. So these will be the symptoms: ocular pain, severe nausea, vomiting, ocular redness. Whatever is told in our classic, same things will be sign, and this will be the what signs you can see in the anterior chamber, and in the corneal edema will be there, flare in the AC and cells, and optic this thing disc will be edematous. That is also very important. Splinter hemorrhages will be there. So all this nasal shifting of the vessels we can see in this initial stage. Then we can also divide this closed angle into 5 types, as other speakers were saying: latent, subacute, acute, and post congestive and chronic. So these stages will be, because closed angle we can correlate to this Vataja Abhishanda, then Pittaja Abhishanda, Kafaja Abhishanda. All the three will be in this stages only. So it will be stage of this angle closure glaucoma, wherein all the patients will complain of pain. Depending upon the signs and symptoms, what our acharyas have told, we have to classify it is Vataja or Pittaja or Kafaja, depending upon the exaggerated symptoms. Okay. So here you see, in Vataja main it is severe pain. So you have to manage the pain. So pain management is very important, along with the other this thing. You have to go for this giving diamox also in order to reduce the pain, measure his pressure, and then also you have to start with the other medicines. And then we have to also sometimes patient will also complain of pain, refer to the other structures, like it will be referred to the ear, or sometimes there will be karnanada, or sometimes this patient will have brahma. So all this will be mixed because of this pain. He will have a mixture of feelings. So that is why it is compared to congestive, acute congestive glaucoma. So in case of this Pittaja, symptoms will be more of vascularity, increased vascularity, redness, congestion, especially the corneus, this around the limbus. You can see the congestion, and also you can see whatever symptoms you can see in angle closure glaucoma. All that signs and symptoms we can see here, and it will be more of. So here, when you are planning, when there is more pain, you have to give Vatahara Chikitsa. When there is more redness, you have to go for Pitta Rakta or same. So in Rakta, the condition will be again aggravated. There will be Sparsha Sahata, then the vascularization will be more. All those will be seen in case of this Raktaja Abhishanda. So you have to plan treatment in that way. So here you see Bandhu Jiva Prakashitam. That is, eye looks very red. So that is one important criteria. When the eye is very red, you have to also diagnose. It may be an angle closure glaucoma, and you have to refer the patient. And tenderness, sometimes there may be bleeding also, and you have to as if the Arishtaka is like it is Arundhata. He says Arishtaka as a Nimba, means it is as if the whole of the eye is submerged in blood. That type of this thing, feeling we can get when we see a patient. And this also is an absolute primary angle closure glaucoma. So this is considered as the starting stage of Hatadi Mantha, wherein the patient will have very severe pain, and also this there will be plain full blind eye. Already he has lost his vision, and his pupil will not be reacting, and iris becomes atrophic, and pupil becomes fixed and dilated, and all this can be seen. And you can see a very good optic glaucomatous optic atrophy. You can see this very clearly. And here what we can do? Nothing, because already patient has lost his vision. So what we can do here is manage the pain. So here they give usually retrobulbar injection, no alcohol and all that. Sometimes last is enucleation of the eye. They have to remove the whole eye because the patient will have severe pain. But what we can do at that stage is we can go for Jalokavacharna, we can go for Rakta Mokshana that is Siraveda, or we can also go for Agnikan, which is very, very good in managing the pain. So in this way, when Hatadimantha patient, when he comes to us, there will be the Adhimant, it is an advanced stage, especially of Vata Adhimant, an advanced stage. And this stage will be in two stages. We can see the response. Either he will go for a thysis bulbi, or there will be this symptoms will be very severe pain, absolute glaucoma type, or thysical. There will be inward sinking of the whole eyeball, and then there will be the cornea will be atrophied. All those changes can be seen. So optic atrophy, everything will be there, no vision. But even if you see the patient, that the eye will be sunken inside. So this is the thysical stage, and so that may be the last stage. After, even after Hatadi Mantha, this may be the last stage. After the severe pain vanishes, then this is the last stage, what we can see. So that stage also is not good. So we can prevent that all stage also, because that will give as the eyeball hole sinks inside it, this thing also will be lost, that look for the patient, that will also not give a good look, because the cornea will be atrophied. All that will also change the structural deformity of the eye. So that is why we have to be, we can also manage this stage. We can go for eye massage, we can go for all the other techniques for pain management. And at this, definitely have a patient, she has already, she doesn't have vision, only light perception also at temporal side, little she can perceive. But this inward sinking, so thysical stage, is gradually going into this thysical stage. So at that, this thing for that patient, even though I have not given her this thing any guarantee, but with eye massage and all that, this stage could be reverted. That sinking of the inward sinking and the corneal changes and edematous changes, and also the corneal opacity or whatever changes are going to take place, that can be reverted back. So this is the explanation what our acharyas, so beautiful explanation our acharyas give for this, that what will happen is internal nerve related to vision, they have told. So that will get damaged. So which is the nerve? That is the optic nerve, as you all know. And this acharyas have also described that this condition, how what happens when vitiated vata enters the inner patalagata, that is the rupa bahasira, then it will expel the drishti and it will give rise to pricking pain. So here it will give rise to pricking pain. And in other variant of this adhiman, this thing, Prakupita Vata dosha reduces bala and tejas. So when the bala and tejas is reduced, that there will be inward sinking of the eye, leading to
Contraction of the eye, let the
and we are seeing this in, clinically also we are seeing this, okay. And in this way, this two conditions our acharyas have explained and given a very beautiful explanation for that. And also they have told the prognosis, how this vision will be lost in different types of adhimant, vataj, pitaj, kafaj, in how many days. And there also is a difference of opinion, and you can see how the vision loss will take place. So it is a very acute condition which needs immediate treatment. So, and diagnostic tools are very, very important. All of you should have this diagnostic tools. All our other speakers have also highlighted. So this perimetry, OCT are very, very important. This non-contact tonometer or applanation tonometer, so that you can measure your IOP. So these tools will help you in diagnosis the optic neuropathy as well as the status of the cornea, the IOP, everything. Okay. So this you have to see the glaucomatous optic atrophy which will take place, and the field defects what has been explained. And in this way, you see the glaucoma treatment, there is not much. Either you can go for this beta adrenergic antagonist like timolol, etc., or prostaglandin anagolist like latinoprost, etc. So here other you can go for surgery, trabeculectomy, filtration operation, all this. So
but you see that all the concentration is given only in controlling dioptry. Why there is no for the optic nerve damage which is taking place? That is itself the silent thief. So that's why our theories have to be reversed, because those are not matching. That is why they have changed the definition of glaucoma. So these are the lakshanas which can be correlated to angle closure glaucoma or closed angle glaucoma. So these symptoms all can be reduced. The patient will not be having sleep. That also can be managed to some extent. And then anjanas also we can prescribe along with the topical drugs. We can give some anjana preparations, especially which are recommended and which will definitely help in not only reducing diopy but also it will give some ocular nutrition to the tissues. So in Pitta Jadiman, same, we have to, because the eye will be very congested and red, we have to start
Rakta Mokshana. Either Jaloka will be best in case of this Pitta and Raktaja cases. So you can go for Jaloka Vacharna. Then other this Nasya also when you are doing, it should Pitta Shamaka. Don't select Kapha Haradravayas here. Pitta Shamaka, HT, Sharkara or Kashmira, all these drugs, Ikshurasa that has been prescribed. So that is why I am telling you, you have to plan the this thing medicine based on the this thing dosha. That is very very important. If you are diagnosing at Pittaja, then all medicine should be Pitta Shama. And then Sekap, Pralepa, then Anjan, all this shit can be done. So this is also Rasakriya method also we can use for Anjan and Aschotan. All this you will get in innumerable formulations are there. Our acharyas have, but we are not practicing. So that is why we have to include all these formulations in a classical method. We have to use this also. So in Raktaja also again, whatever Pittaja line of treatment will the same applies for Rakta also, but it will be in an aggravated manner. So Jaloka Siraver will be very important to control that congestion and the pain, etc. for pain management. And also you can go for this Pralepa, etc. with Pitta Shamaka Dravya. So in Shamana Aushadis, so these are already Brihat Vasakadi Quats. These are proven drugs like they have used for this research work in many of the articles. Patoladi Kashaya, Palatrikadi Kashaya. I have used Palatrikadi Kashaya in case of this for this Basti also. It is very giving very good result. So you can use any of this. Then Shadanga Bubul. Grita also can be used for Tarpan, for Basti, and also internally we can prepare tablets and give. And at the same time, Patya Apatya is very, very important. So if we don't ask the patient to restrict his diet and his ahara and vihara, then definitely the disease will not subside. At least at that stage, we have to advise the patient to follow the proper Patya. So these are the different this thing for this is Ashwatan. So actually there is video also. It's not opening. So this is Ashwatan we can prepare depending upon the condition. So fresh drugs also can be prepared and instilled when we are doing Kriyakalp and Vidalaka. So all this the primary line of treatment. So we can do it at any stage. But when we come to Vishishta line of treatment, when we have to make a drug go into the posterior part of the retina, go for other ocular therapies. So it will, it's not opening. It will open from here. So someone can open. So it is because so here in this way, Tarpan and Putapak should be done as a add-on procedure. Just we click on that dot. Which is there. So this Putapak is also very important because we don't prepare it because it's a very lengthy procedure. But when we do it frequently and the students are used to this procedure, it's very easy. For each and every patient, we do this procedure. So again it is customized treatment for each and every patient you have to, and the type of glaucoma you have to make you have to follow this sequence. You have to finally extract this because I cannot, I have videos on this. That is the last one is the video that we can see. Actually this one is the video. This the video you can अभी छोड़ दो, बाद में नहीं करती हूँ दूसरा, अभी दिखा देती हूँ लास्ट में. So in this way you have to plan your treatment based on this. So in this way the treatment should be depending upon the dosha and all the margas, which marga is affected, that also you have to think. Then we have to also think of Shodhan or Shaman line, at what stage we can give, and the different types of which type of Adhimant it is and what treatment we have to give. And also Murdha Taila also can be planned at some stage when the patient needs some lot of tension will be there in this patient and they will not have sleep. That time you can plan. So this is the Rakta Mokshan we can easily practice, and that is Agni Karma Chikitsa. That also there is video, I think. If you click on that, in that the video, it is a very simple procedure. You can, ye dal do. This is Jalo Kavachar. Most of them they don't do it in direct, but if you definitely, if you do, usually I apply in the upper phonics or lower phonics. At a time I have applied in both the this thing phonics, and the result is really appreciable. This patient on whom I am doing, he had underwent trabeculectomy in right ear once and twice in left ear. In spite of that, his pressure was 45, 50, 60 like that. But after doing rectum auction, surprisingly the pressure also came down, and patient himself is very confident, and he says, I don't want to take allopathy. So even though I referred him to some this thing ophthalmologist, but patient was not preferring. The ophthalmologist also, she told she was a glaucoma specialist. It may or may not control also, I cannot give guarantee. So patient preferred Ayurvedic treatment than this. So in this way, uh, we have a lot of case restrictions are there because of lack of time. I cannot highlight, but what we can do here, this treatments what we are giving, it will need a long time. So you cannot expect results in 1 week, 2 weeks, 3 weeks. It takes months together and years together. But definitely this, if the patient comes with PL positive, then after 2-3 sittings, the patient can be come to hand movement. After that, finger counting. After that, 6 by 60, 6 by 36. Gradually, the vision has improved. I have seen in many patients. We have a lot number of patients who come with this glaucoma, and you can see the how the. But all this is very important. You have to monitor all this. If you have to, like, we have to go for OCT, and you have to. Pressure is very easy to manage, but main thing is we have to see the focus on the glaucomatous optic atrophy, what stage it is and how it is going to reverse. Like, it will take more time, but definitely there is very good. Subjectively, the patient will get very good improvement. So these are the different. So when diabetic patient comes, along with that we have to go for diabetic therapy. So here I told you, especially for primary open angle, this glaucoma is more prevalent. So you can start Madhumehari, Prameha Prahar at an early stage, Nisha Amalaki, so that we can prevent or reverse these changes. This Gokshuradi Gugulu and Punarnavadi Kwat are very good in order to, it will control the intraocular pressure. So that edema, wherever it is, not only in the anterior chamber but also in the optic nerve head, that hypoperfusion which is going to take place continuously, that also can be restricted with this kashayas. So in this way, these are different medicines. Just to concentrate on medicines, see, neuroprotective medicine is a must for any glaucoma patient. Usually I give Ashwagandha, Shatavari, Vidari, Pravala, Shankabhasma and Yashada Bhasma, because that will, it is very important for the Alochaka Pitta. So that I give. And also this, if there is Agni Mandhya, then instead of asking the patient to take plain water, we can give this Mustadi Kwat, or you can go for Dhanyadi Churna, can be taken internally. Regularly, if it is given, then AMA will be solved. So in this way, you have to monitor each and every patient, because I don't have much time. I will not be concentrating, but definitely there is result. What I have seen, so it will sometimes it is because the treatment is not same here. So it is different, varies from patient to patient. So here I have the pitta symptoms. Pitta type we have to use avipatti karachurna, pittantar, shankha pravala, that will give the pitta harak, especially in case of acute angle closure glaucoma. So there we have to also add this brahmivati ashwagandha. So that is neuroprotective, and also it reduces the stress and tension. And also therapy is also, usually I will start this netra parishek. So we can use mix and match of drugs. It is not like you have to use only these drugs, triphala ht, lodra, punarnama, guduchi, etc. That will help in controlling the intraocular pressure. So this netra parishek is very important. Then nasya, especially neuroprotective drugs we can use here. Shirabala 101. So if it is kapha is more and there is nasal blockage and all, then I go for avapidan nasya, either guda nagara I give, or we can go for vachapipali, any of this avapidan nasya for 3 days. And then we have to go for tarpan. So tarpan also With Ashwagandha Ghrata, there is very good result because it is neuroprotective and our aim is to protect the optic nerve head. So that is very good. And also we can give Chakshushya Basti. Sir also has highlighted about Basti. It is very important procedure which has to be given in all the patients that I will tell you because this is very important. A video on kar do. So this is the patient testimony. He has come from Mumbai and he has underwent trabeculectomy once in right eye and twice in left eye, and there is no response. But after doing Jalaka, 2-3 sittings, his IOP reduced, and that's why the patient was very happy. And I have made because at this stage, see, even modern treatment fails. How many operations the patient can do? And it is not only a burden, financial burden, but also it is very difficult for the patient. So that is why this patient, he got admitted. He came all the way from Mumbai 2-3 times, and he took the treatment and is very happy with the therapy. So he himself will give us feedback that how this Jaloka Vacharan and Siravir, it has helped in controlling his IOP. So, okay. आ नहीं रहा है क्या? आ नहीं रहा है? हाँ, वीडियो है, इसको क्लिक कर दो. So this is the patient testimony. So all the therapies I wanted to show you because these are very simple therapies. Pindi is there. Pindi is also very important therapy. So it will reduce the IOP immediately. I have done 2 to 4 Hg of IOP can be reduced. Sometimes if you do it continuously 2-3 times, the pain immediately vanishes. So it is very simple. You can take this dravyas and make it into a bolus, and then you have to make a pindarupa, and that has to be kept over the cornea. So this pressure on the cornea definitely will that pressure will be transferred laterally and it will help in opening the Sclem's canal and drainage of excess of aqueous. So that is why IOP also reduces, and also the patient who will complain of pain, immediately it will reduce. So in our OPD, if the IOP is raised, first we will go for Pindi, and after that we will examine again, and when his pressure comes to control, then only we go for dilatation because we have to take care of that. It's not opening. Nahi open ho raha? No. So this was a patient testimony. And as madam was also focusing that more research is needed in glaucoma because it is the need of the hour now, because we have very few research works, and now we have to come up with more and more yogas. So this Netra Ashini Ras is a very, very important preparation, and it is having all the neuroprotective drugs, Tamra Bhasma, Loha Bhasma, and all the Rasaushidis are there, and it is a very, very important preparation which is which will help in controlling the neurodegeneration. So you can recommend this drug, but it is not available in the market. You have to prepare it. And then you can also go for this Basti, as I told you. It is very important procedure, and you can also adopt. I think there was a slide on Basti also. So this is the published work. One is on concept of glaucoma, and there are many articles on glaucoma, analyzing what is glaucoma. So you can also go through that. And in Basti Chikitsa, I will tell you because that slide is missing. So in Basti, what happens? Like when we are giving orally, only how much ml we can give? 30 ml maximum. But in Basti, when we are administering Quatha, it will be maximum dosage 400, 450, like that, 480 also it is given. So maximum dosage, if it reaches given through Basti, that will bypass the liver, because liver will not allow some materials to enter. So bypass the liver, portal circulation, and then it will directly enter into the this thing, posterior chamber. So here also, this excess of drug, if it is given in this way, that will also be able to penetrate. Penetration will be very better. So that is why we have to plan for Basti. And this Bruch's membrane, whenever there is inflammation, there will be gaps. So that's why through this gaps, our drug, whatever it is, it can easily penetrate in this manner. And also if we are using Anuvasane Basti, that also will be 50 ml, like that, because Snehana we cannot go for maximum every day, we cannot use. So we can use this therapy, it will give very good result. So that's why what I would like to conclude from my side is that Ayurvedic intention in the form of all these therapies what I have described, like Chakshusha Dravyas, Anjan, Tarpan, Kutapak, they are to be implemented, and we can prevent this nerve damage. And also allopathy drugs, if we are using that also, we should not stop. We have to control IOP with this topical drugs, and at the same time give Ayurveda intervention. And long-term therapy is very much needed. We cannot expect immediate results, and timely checkup and early intervention will prevent blindness, which is equally important. And so you can conclude and take home these points, like what Kriya Kalpa, at what stage we have to adopt, and Chakshusha Dravyas, which we can use. Here we can use immunomodulator drugs, neuroprotective drugs, and Triphala HT Rasayan Ghanavati that can be taken. And then this lifestyle modification, increased screen time, stress, lifestyle disorders, all these are emerging. So you have to control your stress. You can go for pranayama, then other shirodhara, etc. And patya ahara vihara, that will also take care to most of our problems. And then this complementary therapies, that's why yoga and pranayama, that can simultaneously be clubbed together, so that we can, and also modern therapies, whatever is given to control the IOP. So if we plan in this way, definitely we can achieve very good result. So thank you for patiently listening, even though it was a lunch time. So I'm very happy that students have stayed back to listen to my lecture. Thank you once again. Six-day CME program for teachers, 2 days national conference for national conference from all over India. We had faculty, students, everyone, and many CMEs, 1 day CMEs. And Abhishek was a part of each and everything. So that's why he can organize this such conference in a better manner. And I would like to thank the organizations for giving me an opportunity to present my and express my views. Thank you once again.
Thank you so much, ma'am, to sharing us with your deep knowledge. मैडम के मिट और सर्टिफिकेट के लिए मैं प्रोफेसर मीना यादव मैडम को बुलाना चाहूँगा। मैडम मेरे पीएचडी के गाइड रहे हैं। अभी 1-1.5 महीना पहले ही मैं ये कॉलेज छोड़कर यहाँ पे ज्वाइन किया है। उससे पहले मैं मैडम के साथ ही था। एक बार जोरदार तालियां हो जाए मैडम के इस इतने फ्रूटफुल और बहुत अच्छे लेक्चर के लिए। इन लेक्चर्स के बाद भी हम मैडम से मिल सकते हैं। हमारे मन में जो डाउट है, जो क्वेश्चन है, वो